All right, guys, we're gonna do some quadricep stretching now. Most of you know your quadriceps are the muscles on the fronts of your thigh. They work to extend your knee, but they also flex your hip. Quad means four. There are four different muscle bellies. Three of them start on your leg, on your thigh, and they attach below your kneecap. The other one starts above your hip and also attaches below the kneecap. So in order to get a good stretch of your quad, we have to flex our knee and we have to extend our hip. This is not a start pose. This is after your quads have been stretched a bit, maybe sitting like this in Virasana. This will definitely increase the intensity of the stretch for your quads, and we'll also get a hip flexor component as well for those psoas and iliacus muscles. So we'll put a blanket down on the floor so that your kneecap has some padding, and Alva's going to back into the wall. She's going to take her right knee on the floor and she'll take her foot up the wall. So here's where you need to be careful. If your quadriceps is a bit tight, you'll take your knee away from the wall a little bit. Just show them you got it. And look back at your foot. You can see the foot is straight up and down. It's not sickled in or out. Don't sprain your ankles in the attempt to stretch your quadriceps. She'll inhale, and on the exhale, she'll bring her left leg forward and put her foot on the floor like a lunge position. She'll take her hands onto her knee, and she'll push into her knee, and she'll straighten her spine. So what do we mean by straighten? Don't get rid of the arch in the low back, but don't have an accentuated curve in your low back. If you get into this position and feel that your low back is way arched, you need to move your knee away from the wall a bit. She looks pretty darn good there. Okay. So for progression, she'll start to walk her hands back towards her thigh, or up her thigh towards her hip. You got it. And she'll take her left hand and push her hip down, and she'll grow her spine very tall. You feel a big stretch in the front of your right quad? So that's where she stops with the knee position. To get more of a stretch, take your right arm up now. If you can, reach up. Yeah. So eventually, when she gets a little more flexible, what will happen is she'll push her buns back to the wall, her sacrum to the wall, and her back will go to the wall. This is all fine and good right now as it is. Lower your right hand back down. Put your hands to the floor. And now we'll stretch her hip flexor. So she'll take her right knee and pull it away from the wall, a whole bunch, and curl your toes under so you're stable. This left leg will walk forward and out in a diagonal so her toes point to the edge of the mat. She'll keep her knee in neutral. Okay. Inhale, and on your exhale, let the whole front of your hip start to drop forward, flexing, beautiful, extending through the hip, getting the flexors to release, and then she'll put her hands or elbows down on the floor. Can you get your elbows down? Beautiful. So the idea here is, look at this beautiful opening of her hip flexors. You can't see this so well, but the other side, she's going to open and close her screen door of her left hip here, so she'll get some nice articulation through the hip socket. Notice how all this is neutral, so her sacroiliac joints and low back are not compromised. She'll bring the leg back to rest. She'll walk herself back up again, and then go back into your quad stretch, and it'll be that much easier. So the foot releases back. Yes, ma'am. Slide your knee back a little bit further, back where you started. And then walk this foot back. And see if you can push up and see if it feels a little freer. It certainly does. Nice. So a big stretch across the front. Hold it for a few breaths. Remember that you keep your concentration on the target the whole time. You're not thinking about everything else. She's targeting in on where her sensations are, and she'll be able to release that. And as you progress, move the knee back further, and you can slowly start to take your body back a little bit further towards the wall. Thank you.